Welcome to Breaking the Couch, a weekly conversation demystifying what happens in and behind the therapy scene to support your healing journey. We're your hosts.
I'm Dr. Doughton, a licensed clinical professional counselor, a certified school psychologist, and a trauma specialist with Playfully Psyched.
And I'm Dr. Joe Harchi with Soft Heart Psychology, a licensed clinical psychologist.
We're here aiming to provide you with mental health tools to address the cycle of generational trauma across the age span, from infancy and childhood to adulthood.
For more information, visit our Instagram page at Breaking the Couch or our website, breakingthecouch.com. While we hope you love listening to and learning from our podcast, it's not a substitute for a relationship with a licensed mental health professional.
All right. Hi, Dr. Joe Harchi. We're back today, back on that couch.
Hi, Dr. Doughton.
Hey. So I know that our plan today is to talk a little bit about how therapists keep showing up, especially when we work with trauma or we have cases that are trauma cases. So how do we kind of navigate that? Those behind the scenes. We thought that that'd be really good for people to hear us talk about and process. So I don't know, I could jump in and go first, or do you have ideas that you want to, I can talk about this for hours.
Yes, that's right. That's right. I mean, it's kind of like where clients will be like, hey, I'm sure, Dr. Joe Harchi, I'm sure that you get sick of hearing me in and out talk about this or that. And I'm like, no, actually don't. This is what I love to do. I love to talk about how that pattern or that cycle shows up for you now and where it came from and how certain parts of that pattern might not be serving you today, but how we could look at it in a non-shameful, non-blameful way. So, yes, I'm right there with you. I'm so happy we could talk about this. Again, with the hope that, folks will hear this and then hear that we aren't behind the scenes thinking, oh my gosh, I wish they would stop talking about this thing.
I think with the behind the scenes part, I'm just gonna jump right in. What that made me think of is how often when you have a really strong therapeutic alliance with a patient, they think about you as a therapist, right? And they worry about you as well. And they worry that they're going to be harming you by sharing some of their information. Especially in the context of, we just went through / are still going through, depending on the country you're in, part of the U.S. that you may be in, your own feelings and experiences, but pandemic, civil rights movement, and uprising, and revolution, and so many things in between that found patients kind of being afraid to bring up topics because they were afraid that it would either harm me or be too much on me. And what comes to mind a lot right now is, what we're calling Black Lives Matter Summer of 2020. And how at the time I had most of my patients were Black, but I did have patients that were white, and patients that were of other races and ethnicities. And you could tell that when they kind of come to the session, they're like, the questions that they don't ask, the statements that they don't say. So for me, one of the things that I did was make a purposeful effort to say at the beginning of all of my sessions, at least the first time, is a reminder that basically I got you, right? Like, my job as a therapist is to be able to carry and hold whatever you bring, and that I'm going to be doing my own work behind the scenes, sometimes with a therapist and consultation in other ways, but to make sure that I can show up strong enough to hold what you have to give me, so you don't have to worry about saying the wrong thing or saying too much and harming me, because that's my job. My job is to protect and worry about me and you. I don't know, did you have any similar experiences, or what was that like for you? Either Black Lives Matter Summer 2020 or any related experiences you've had?
Yeah, that's a great question. And thanks for being open with myself and with us listeners, about your experience. I am thinking a little bit about that summer and, of course, before and after that too, just being a provider in a white body and what comes with that privilege, I do name that in my sessions. I name that whether I'm sitting across the room from someone or, virtually
It's the
with someone,
same.
right? I'm gonna say it, but no matter what, I am always bringing that up in the room. So if they are also in a white body or they are, Latinx and they have a light skin tone, or they are also Iranian American and they have the same skin tone as me, no matter what, I'm bringing up that layer of privilege because even if we are, for example, from the same backgrounds, I do want to bring that up. And for the most part, that is something that every one of my clients at that time and since has been able to look at for themselves too. So for me, there's also this act of I'm bringing it up and we can also look at this. And so it's also been a great part of growth for my clients. And I'm really happy that they will look at that too. I don't know if other providers are doing that. I don't know because I'm not in their rooms, but I hope that they are. And as far as with Black clients, I did also bring that up. Um, and so I just didn't want that to be a burden that they would have to try and, worry about, oh, is she going to be able to handle this? Is she going to be able, and maybe they still did, no matter what I asked and processed and put out there. I'll never really know, right?
Mhm,
I'll
mhm,
never know what it was like in their shoes and what it
mhm,
continues to be like in their shoes.
mhm,
So I did my best to name that, as you and I have talked about, name that in the room so that they don't have to. So they don't have to kind of do this, oh, this poor white fragile lady, like is gonna just do backflips around this topic. Absolutely not.
mhm,
No.
yeah. Bring it into the space. I used to say, there's that saying about the elephant in the room, and so
Mhm.
paint it red, like a bright color, paint it red, so we can address it, right? So it's sticking out there, put some stripes on it, whatever we need to do, but it doesn't serve anybody in therapy any good to pretend like a huge topic doesn't exist. Um,
Mhm.
and I know this is something we talked about years ago, but when we think about race, I can't I can't hide. I don't want to, but I can't, right? It's you see me and here I am, I'm Black, right? Even with that, from the time that I started working, therapeutically, I would bring that up to patients, bring that up to families. Um, because again, most of the time I would be the only Black, if not the only person of color, period, in my training programs. Again, there was one training program I went to that was an HBCU, and mm, that is not, I'm not necessarily counting that. Although in that class, in that program, in my graduating cohort, I was the only Black person, which is interesting. I know, and I know, but uh, yeah, I still brought it up to people because I would otherwise I had found if for some reason I didn't do it, then I'd get the weird microaggression comments of you're not basically like you're not like the other ones, right? Like,
Ouch.
oh, yeah, stuff like that. So I would just bring it up and like let's talk about it. And for me, right, because this is what comes up for therapists and how do we manage that? Those things aren't the hard parts for me to manage. Again, maybe because it's trauma, but that's something I've experienced my entire life, right?
Right.
I'm not surprised when I would get, a microaggression like that or get some weird statement about, oh no, or some pretending like, no, 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 I don't even see color when I'd bring it up, and we'd have those conversations. It really didn't. The problematic part is that it wasn't problematic, that it wasn't something I need to process away because it was like, yeah, this is a part of my experience. Um, Now, when it comes to trauma, different types of trauma, especially like child abuse and sexual trauma, those are the ones that I'd find myself making sure that I needed to ground myself in between sessions, or where I benefit the most from having consultation with other trauma therapists that I feel really comfortable with, so that I can say, hey, this is what came up for me. Sometimes it's just to be able to say that, like, just to be able to put it out there on someone else, with someone else in a safe space, and just be able to say, yeah, this was heavy or hard. Um, and I protect my peace, as they say, like
Hmm.
my boundaries. If there's anything that's great about me, I think, are my boundaries, like hands down. Um, because if I'm going to show up for other people, I need to know how to show up for myself.
So when I hear you saying that,
Mm-hmm.
that makes me feel like if I was your client, I would be able to come to you with anything. That makes me feel like clients can rest assured knowing that they can share the skeletons in the closet, as they say, or like their deepest, darkest stuff, any sexual traumas, any traumas under the sun that
Mm-hmm.
they may not have been able to tell their therapist, because not every therapist is going to protect their peace, as you said, and have those boundaries. So I love that you bring that into the room. And I'm I have to say I like honor you for that, because I remember when I was like sharing some of my cases with you, I do feel super comfortable doing our trauma consultation. And you were like, "Did you know these are all," it was like a rerun of like 5, 10 years ago, right? "Did you know these are all sexual trauma cases?" And I was like, "Oh my gosh, no wonder I'm so tired." And you were just reflecting that. Yes, no wonder you're so tired. And so, but we then, as we share it with one another in this safe, confidential setting behind the scenes, we're able to show up so much better. For me, in hearing that from you, I was like able to show up so much better for my clients, really refreshed, really present, really attuned. And I just appreciate, you know, the simplicity, it's not easy, but simple, of the boundaries for some of the taboo stuff. Mhm.
Mm-hmm. Mm-hmm. The taboo stuff in quotes, because there's no such thing as something taboo in therapy, right? Talk about it, bring it out, right? That's what we're trying to help people understand, that, if you find a therapist that's a good fit for you,
Mhm.
um, and that's doing their own work, nothing is taboo. No
That's
topic
right.
is off the table to be discussed. Um, and if there's something that's off the table to be discussed, and your therapist lets you know that, and you really need to discuss it, then that's probably not continuing to be the therapist that was for you. Because you also don't have to stay with the same person for, ever. Sometimes you need to switch, but um, there's no such thing as a taboo topic in therapy.
That's right. The so-called taboo stuff is like what people will come to us in those 15-minute free consultations. They'll be like, "Hey, I wanna tell you this stuff that I never told my other therapist." And I'm like, "Oh, man," like, sometimes we really miss the mark,
Mm-hmm.
as far as a field and not asking those things. So I know you and I have certainly like put those aces into our intakes. We're asking clients, we're bringing that in, we're inviting in, as Invisible Man Got the Whole World Watching talks about. He talks about we invite people in to share these components of themselves
Mm-hmm.
rather than waiting for them to hopefully say what they want to say. It's not that we're pushing anyone in, we're inviting them in, and therefore at the end of the day, then nothing is actually taboo, as you said. Yeah. Mhm.
Mm-hmm. Mm-hmm. Absolutely. Absolutely. I think that it's just so important that one of the things you said is that, we sometimes really miss the mark as a field. And you're right. There's no such thing as a perfect therapist, or someone that's doing it perfectly all the time, or any of those things. I also just want to let people know that they don't have to carry shame or guilt with not having shared something with a previous therapist. And it doesn't always have to be blame either. It could be readiness,
Hmm.
right? Readiness of fit for
Mhm.
within that relationship and or with that person. Um, and I say this especially with trauma, um, and especially with trauma that happened in the earlier developmental stages. So kind of like pre 25 years old. So any trauma that you've had from conception or birth through age 25 looks different over the years. And there'll be different times we need to process it a little bit differently, where you have a better understanding, where more memory surface or more details surface, things like that. So you may not have been ready to share what you shared. Maybe the therapist didn't ask the right questions, or maybe they did and you weren't ready, or maybe they didn't know how to push you as hard. Maybe they would have pushed just the right amount of hard and you would have shut down completely because you weren't ready. Like all of those things play a factor. And I think that the point is we can celebrate when you're ready to tell, right? And hope that when you're ready to tell that you have someone that is super supportive, that is able to take that disclosure and handle it with care the way that a patient deserves.
That's right. Yes, I love that you bring up that thing, this piece of not blaming because giving me a chance and I'll unfortunately always blame our field of psychology. There's so many problematic areas with our
Oh my
field.
God,
I know
absolutely.
you and I agree on this.
Mhm,
But I like that you think of things in a little bit more complex way as far as it doesn't have to have been that your therapist missed the mark always. It could be that now you're ready.
mhm,
And hopefully that lands softly with a therapist who's really skilled at kind of handling and cradling that disclosure.
mhm,
That's
mhm,
what I would hope for, my loved ones.
mhm,
Absolutely.
mhm, absolutely. Yeah, yeah. That all things or many things can be true simultaneously, and one or the other, and all those things. No, you already know. That'll probably be another episode that we could have on some
Mhm.
of the downfalls and pitfalls of our field and ways in which we're attempting to change that. But so I'm curious if it's okay to ask. I'm curious, what is your process for making sure you're able to show up for your patients? What does that look like for you?
It's really funny you say that. I was just thinking about sharing what came up in a presentation over the weekend.
Mhm,
Over the weekend, I got a chance to work with therapists on how they can serve their LGBTQ clients,
mhm,
specifically young LGBTQ people.
mhm,
So I loved this work. I loved it. I did kind of break the couch with them, right?
mhm,
As far as what I'm doing in between sessions. So when the heavy stuff comes up or when stuff comes up and life is happening around me, right? It could not
mhm,
even be anything that they disclose. It could just be what's going on in life. And because I'm a person and they're like, Dr. Joe Harchi, I don't want to burden you with this, or I don't want to, you know, um, I hope this isn't too much. I'm like, oh my gosh, no, or I hope I'm not revisiting the same thing over and over and it's bothering me,
mhm,
These are ways that I show up. I couldn't show them because I was not wearing appropriate, like I was wearing a dress, so I couldn't show them. But I literally put my legs on the wall. You, Dr. Dalton, could see this because we're on
mhm,
video right now. But I literally put my legs on the wall in between sessions and I breathe. And so I breathe into the backs of my legs. And I do that for just, I don't know, maybe like a couple minutes.
mhm,
Um, we meet on a weekly basis
mhm,
to support one another as far as providing consultation from those trauma recovery lenses.
mhm,
I will go outside and walk for a little bit, even just for like a couple minutes,
mhm,
especially if I can grab my friend, my dog. Um,
mhm, mhm,
so he kinda helps me to be present on that walk because I could go breathe or walk or do anything and just absolutely not be there, but
mhm.
somehow my little friend, he helps me. The dog helps kinda focus on that little one thing, right?
Yeah, yeah.
Let's see what else. I do a lot before and after sessions to get ready.
Mhm,
So before sessions, I'm doing my own stuff that I need to do, doing my own stretches or my own movement, doing my own meditation, prayers. After session, I'm closing up the room and leaving everything where it was
mhm,
so that I can kind of let my own parasympathetic nervous system get on board and get my own rest. So that's kind of in a nutshell. Does that mean I don't, like, forget to have enough water sometimes, or I have to, you know, like, I don't know, just normal things that I'll forget like that?
Mhm.
Yeah, of course, I forgot to have enough water yesterday,
So you're saying
and
you're not perfect.
eh
Yeah.
thank you.
Yeah.
Exactly. Exactly, absolutely. So I could be over here talking about the parasympathetic nervous system all day, but there are days where, you know, I forget.
Mhm,
Mhm.
mhm. Yeah, absolutely. I love that. Basically, I was thinking, yeah, practice what I preach as much as possible. Do some of the same things I was also thinking about. So my old office, or I've had a few offices over the past couple of years. My one of my offices from last year was so great because it had like an outdoor deck area, and oh, I'm telling you, and I could go sit and soak in the sun. I could do a couple exercises. It had like I would like run up and down the stairs a little bit. Like just it was amazing, and I miss it to pieces. And then I had another office where it was just on a huge lot. And so I would often take a walk in between sessions to like take in the sun, the air. I'm always trying to get some steps in, or you, frequently I'm trying to get steps in, but just
Mhm.
it feels good to step outside of the building, to say hello to fresh air, to sunlight, to just go on a mindful walk. um, and when I can't or don't do that, I will take deep breaths in between sessions. I will do pretty much all of the strategies that I give patients. I do them as well. But then I also really encourage patients, especially when we're first learning about mindfulness, or we're first learning about the parasympathetic nervous system and how to ground yourself and what your body needs. We practice it in session. And I am not just like, let me watch you creepily doing some deep breaths, or like, right. I'm like doing it with them. And I'm not gonna lie, that's gonna help me. That helps me stay regulated. It helps me stay in the moment too. And it's modeling that for them, right? I'm not
Mhm.
just doing lip service, right? I'm doing the work too. And I can say, even for myself, I've seen such a huge difference between me now and me, a decade ago, where I wasn't so good about doing these things, you know? Um, so I can know there's healing involved because I can feel it in myself too. But yes, a lot of the same things that you do. And I don't stretch as much like on the ground stretching, but I do like a lot of leg stretches from like seated positions just because of my calves and ankles need to like they get bunchy. But yeah, I think that's just really important that they know we are doing our work behind the scenes, you know?
I do, and I love that. And so I guess I hear from what we're both saying is that before, during, and after, we are tending to ourselves so that we could show up so present and with
Mhm.
all our best components of ourselves there with them, there with
Mhm.
you.
Yeah.
So I hear that we're kind of both on that same page of doing what we need to behind the scenes so that we could show up our best
Mhm.
selves.
For sure. And I just want to say, just like you said, like you're not perfect. I'm not perfect either. There are definitely days where I'm like, oh my gosh, I have not gotten up in 4 hours because
Mhm.
I would like, well, let me get this note done in between the session instead of prioritizing the fact that I need to stretch my legs, or like, I would just, well, let me just quickly check this email, whatever. So there are definitely those days and I pay for it. Like, they're not good. And so I try to remind myself, okay, do better next time. Right. And I don't want to beat yourself up, but do better next time. But I definitely try to make the effort for myself, and then I know I can show up for my patients. So I think that's like a glimpse into what therapists can do, how to set those boundaries, what those boundaries can look like for them, and yeah, that we're practicing what we're preaching.
Right, right. And by the way, those emails get me too. I would say, like, the one little email in between a session is almost always gonna eat up my time, that I could have had to just kind of reset and rejuvenate. And I'm like, why did I do it again?
Yeah,
Yeah.
yeah, it's pointless, especially for me, like, I struggle with being able I can't send, like, there's no such thing as a two-minute email because I'm
Mhm.
gonna proofread it 50,000 times, and there's still probably gonna be a typo in it, but
You
I
and me both, right?
take a long
Mhm.
time to send emails, so what makes me think that the 7 to 10 minutes that I have in between sessions, I'm gonna be able to do a quick email, like, come on, Dr. D, like, no, but, no, we are human, and we make those attempts, and we're learning from them. It's a progress. It's a process.
I'll probably replay what you just said so I could just remember, wait, before you touch that email, just don't even just do it after your sessions. Yeah.
Mhm.
Yeah.
Yeah, absolutely. Well, I think that's probably our talk for today. It sounds like we're in a
Mhm.
good stopping point.
Yeah.
I really enjoyed talking about this, and I hope that, potential patients, people who are out there in therapy for themselves, are learning a little bit about what therapists can do to stay grounded.
Me too, and I'm also hoping that if people did want, like, a part 2 or chapter 2 of this and, if they kinda
Yeah.
wanted a little bit more from us because you did mention, "Hey, this is a glimpse." So, I'm hoping that if you felt that you'd like more, you would let us know.
Absolutely. Yep. You'll be able to like email us, check us out on these different platforms that you'll hear about. Absolutely. Yeah. Let us know. That's a good one. And we're going to have, so they can kind of call in or leave voicemails and
Mhm.
we can answer questions directly. So that'll be really fun.
Yes, it will.
All
Mhm.
right. Well, I will see you next week as we, break the couch a little bit more.
Yes. See you then.
All
Bye.
right. Bye bye.
If you are looking for a therapist for yourself or your child, you can visit our websites, playfullypsych.com or softheartpsychology.com.
We appreciate you joining us this week and can't wait till there's another opportunity to jump on the couch with you next week.